Так, only 2 students. Quality of medical care, today's lecture. So, quality of care is the degree to which health services for individuals and populations increase the likelihood of desired health outcomes. It is based on evidence-based professional knowledge and is critical for achieving universal health coverage. As countries commit to achieving health for all, it is imperative to carefully consider the quality of care and health services. Quality health care can be defined in many ways, but there is growing acknowledgement that quality health services should be, first of all, effective, safe, and people-centered. Effective, it means providing evidence-based healthcare services to those who need them. Safe, avoiding harm to people for whom the care is intended. And people-centered, providing care that responds to individual preferences, needs, and values. To realize the benefits of quality health care, health services must be timely, equitable, integrated, and efficient. Timely means reducing waiting times and sometimes harmful delays. Equitable, providing care that does not vary in quality on account of gender, ethnicity, geographic location, and socio-economic status. Quality services should be provided to all people who need them, be they poor, children, adults, old people, pregnant women, disabled, etc. Quality services should be available in all parts of the country, in villages, towns, and cities. Integrated, providing care that makes available to full range of health services throughout the life course. Efficient, maximizing the benefit of available resources and avoiding waste. Quality control. The purpose of quality control and safety of medical activities is to improve the quality and efficiency of medical care and ensure the safety of patients and employees of medical organizations. The results of the control are the basis for making major decisions and carrying out corrective measures in the sphere of quality aimed at preventing medical errors and other defects in work, improving the efficiency of resource use, quality, and efficiency of medical care. The implementation and results of management decisions are also monitored accordingly. The main law, as you remember, is Federal Law number 323 on the basis of public health protection in the Russian Federation. So, according to this law, Article 2, quality of medical care is a set of characteristics reflecting the timeliness of medical care, the correctness of the choice of methods of prevention, diagnosis, treatment, and rehabilitation in the provision of medical care, the degree of achievement of the planned result. Article 4 of this federal law bases principles of public health protection, availability and quality of care. Article 10. Accessibility and quality of care are ensured by availability of the necessary number of medical personnel and their level of qualification. The possibility of choosing a medical organization and a doctor, application of procedures for the provision of medical care and standards of medical care, provision by the medical organization of a guaranteed amount of medical care in accordance with the state guarantee program. Article 14. Powers of federal public authorities in the sphere of health protection. Organization and implementation of control in the sphere of health protection, including compliance with the requirements of technical regulations in the field of health protection. Quality control demands the certain system, including the concept, methodology, and technique and technology based on uniform approaches, criteria, and indicators. In accordance with international standards, quality is defined as a combination of the properties and characteristics of a product or service, and which gives it the ability to meet established or implied needs. In healthcare, the following groups of goods are distinguished: medical services, medical preventive, diagnostic, medical supplies, medicine, dressings, equipment, medical information, medical specialists, and medical institutions. With regard to the quality of medical services, the terms are used: assessment, assurance, control. Quality assessment, determining the actual level of quality of care. Quality assurance, determining the actual level of quality of care and taking measures to change it. And quality control is the same with quality assurance. There are three approaches to quality control in healthcare. They are structural, processing according to the final result. Three approaches. First approach is structural. The structural approach is implemented in fulfilling the requirement of the standard of equipment, licensing and accreditation of medical institutions, certification, accreditation of specialists. The essence of the approach is that a high-quality medical institution, equipped in accordance with the requirements of the standard, high-quality equipment, medicines, professional specialists provide high-quality medical care. Many requirements for the structure of a medical organization are set out in the procedures for providing medical care. According to the Article 37 of Federal Law number 323, medical assistance is organized and provided in accordance with the procedures for the provision of medical assistance mandatory for execution in the Russian Federation by all medical organizations. Procedures for the provision of medical care are approved by authorized federal executive body. The procedure for providing medical care is developed according to its individual types, profiles, diseases or conditions, groups of diseases or conditions, and includes first stages of medical care and second rules for organizing the activities of a medical organization, its structural supervision and doctors. The standard of equipping the medical organization and its structural divisions, recommended staff standards of the medical organization, its structural divisions, other provisions based on the characteristics of the provision of medical care. As an example, you can see on the slide Department of Pulmonology standard equipment, name of medical equipment and number of beds up to 30 beds, 31, 60 beds and over 60 beds. According to amount of beds, medical equipment differs. For example, the blood acid base are the same. But for example, devices for creating high pressure in the airways should not be in the hospital with less than 30 beds, but should be in the hospitals where over than 60 beds. It should be only one, but for example, aspirator surgical should be amount of this device up to 30 beds should be one. In hospitals where 31 to 60 beds, this aspirators should be two surgical aspirators, and in the hospitals over 60 beds, surgical aspirators should be 3. Also, on this slide you can see machine for washing and disinfection of flexible endoscopes with water filtration system, X-ray mobile radiographic device, bronchofibroscope, standard of care for patients with upper respiratory tract infections. Also, it is example on each disease standard. There is standard. No, but for example, for patients with upper respiratory tract infections, what should be? Functional bed, cardioanalysis, disinfection boiler, oxygen concentrator, acetol drugs, for ecological testing. Hospital wheelchair should be also according to the beds. If over 60, not less than 3. Hospital wheelchair should be disinfection boiler if in hospital with more than 60 beds, not less than 6. So you can see the standards on the slide. Lamp by the number of chambers, rooms for medical procedures, otoscope, pterinoscope, devices message, bedside monitor, frontal mirror, lung tester, tool table. Next approach to quality control in healthcare is processing. The procedural approach should complement the structural approach to quality control, based on the standardization of medical technology. In accordance with Article 37 of Federal Law number 323, medical care is organized and provided on the basis of standards of medical care, with the exception of medical care provided as part of clinical testing. The standard of care is developed in accordance with the nomenclature of medical services and includes averaged indicators of the frequency of provision and multiplicity of use. Health services, medical products implanted in the human body, and blood components. Medicines registered in the territory of the Russian Federation with indication of average doses in accordance with the instruction on the use of the drug and the pharmacotherapeutic group on anatomical, therapeutic and chemical classification recommended by the World Health Organization. Types of therapeutic nutrition, including specialized medical food, are based on the characteristics of the disease condition. Standard for care for patients with upper respiratory tract infections. Patient model, age category, children, adults. Nosological form can be acute nasopharyngitis, other acute infections of the upper respiratory tract of multiply localization, acute infection of the upper respiratory tract unspecified, acute laryngopharyngitis, chronic rhinitis, chronic nasopharyngitis, chronic pharyngitis. Also the code you can see. Face any, stage any complication, regardless of complication, condition of provision in patient care. Diagnostics according to the code: name, collection of anamnesis and complaints in diseases of the upper respiratory tract, frequency 1. Visual examination of the upper respiratory tract, one time should be. Palpation in diseases of the upper respiratory tract, examination of the upper respiratory tract using additional light sources, mirrors, also one time. Measurement of respiratory rate, pulse examination, general thermometry, also one time. X-ray analysis, description and interpretation of radiographic images, computer tomography. How we can check 0.2? We can take cards of patients and count how many times computer tomography of subordinate clauses were performed. So not all patients should be performed computer tomography, but not less than 0.2. We should count. Description and interpretation of computer tomograms. Serological research of level of white blood cells, erythrocytes, also you can see the standard information about treatment. If patient stays in the hospital for 14 days, also you can read about his treatment. Treatments also should be according to the standards of medical care. So one time during his station in the hospital should be collecting the anamnesis and complaints in diseases of upper airways. One time should be visual examination of upper airway, palpation, and average quantity 20, of course. Rhinoscopy, laryngoscopy, blood draw from a finger, blood draw from peripheral, mind removal of polyps, of nasal causes, if it is necessary. Purpose of dietary therapy in diseases of upper airways. Purpose of the medical and improving mode in diseases of upper airways. Daily observation of the resuscitation patient. Tenectomy. 0.2. Don't select any 0.2. It's about treatment. You can see on the slide. General thermometry also should be measurement of blood pressure, care for skin, care for an oral cavity, care for vascular catheter, care for a constant uric catheter. One time should be in 14 days. Pulse research, respiratory rate measuring, measurement of frequency of heartbeat, training in self-leaving statement of cleansing animal. Röntgenoscopy of lungs, description of this, definition of the main blood types, definition, factor, rhesus factor, accessory, and also what medicine should be, also how many doses, for example, ketorolac should be not less than 0.5, 30 milligrams. So the treatment also you can read from standards. Next approach is according to the final result. Evaluating the quality by the result, it is necessary to answer the question, what is the result? The implementation of standard technologies should provide a predictable result. Result of the medical help, outcome of treatment. Recovery, improvement of a state without changes, aggravation of symptoms, death. Article 64. Examination of the quality of medical care. An examination of the quality of medical care is carried out in order to identify violations in the provision of medical care, including assessing the timeliness of its provision, the correct choice of methods of prevention, diagnosis, treatment, and rehabilitation, the degree of achievement of the planned result. The criteria for assessing the quality of medical care are formed by groups of diseases or conditions on the basis of the relevant procedures for the provision of medical care and standards of medical care, and are approved by the authorized federal executive body. Now you know what is the standards and what is it procedures for the provision of medical care. An examination of the quality of medical care provided as part of compulsory medical insurance programs is carried out in accordance with the legislation of the Russian Federation on compulsory medical insurance. The examination of the quality of medical care, with the exception of medical care provided in accordance with the legislation of the Russian Federation on compulsory medical insurance, is carried out in the manner prescribed by the authorized federal executive body. Ministry of Health of the Russian Federation, Order number 520 N of July, on approval of criteria for assessing the quality of medical care. According to this order, these criteria for assessing the quality of medical care are applied when providing medical care in medical and other organizations engaged in medical activities that have a license for medical activities obtained in accordance with the procedure established by the legislation of the Russian Federation. Quality criteria are applied in order to assess the timeliness of its provision, the correctness of the choice of methods of prevention, diagnosis, treatment, and rehabilitation, the degree of achievement of the planned result. Quality criteria are applied by groups of diseases, conditions, and by the conditions of medical care, outpatient, inpatient conditions, day hospital, So quality criteria for different conditions of medical care. First of all, quality criteria in outpatient conditions. Maintaining medical documentation, medical record or history of the patient, receiving medical care on an outpatient conditions, a history of the child's development, the individual card on the pregnant woman, and the maternity hospital, further the outpatient card, filling in all sections provided for by the outpatient card, availability of informed voluntary consent for medical intervention. Primary survey of the patient and terms of delivery of health care, registration of results of primary survey, including data on the anamnesis of a disease, entry in the outpatient card, establishment of the preliminary diagnosis by the attending physician during primary admission of the patient, forming of the plan of inspection of the patient and primary survey, taking into account the preliminary diagnosis, forming of the treatment plan at primary survey, taking into account the preliminary diagnosis, clinical manifestations of a disease, disease severity or a condition of the patient. Prescription of medicines for medical use, taking into account instructions for use of medicines, age of the patient, sex of the patient, disease severity, existence of complications of basic disease state, and associated diseases. Establishment of the clinical diagnosis on the basis of data of the anamnesis, survey, these laboratory, tool and other methods of research, results of consultations of the specialist doctors provided by standards of medical care, and also clinical recommendations, so-called protocols of treatment concerning delivery of health care. Further, it will be named clinical recommendations. Registration of justification of the clinical diagnosis, corresponding entry in the outpatient card, establishment of the clinical diagnosis within 10 days from the moment he was admitted, patient was admitted, carrying out at difficulty of establishment of the clinical diagnosis of a consultation of doctors. At previous lecture we told about commission of doctors with entering of the corresponding record into the outpatient card with the signature of the manager of outpatient and polyclinic department of the medical organization. Entering of the corresponding record into the outpatient card in the presence of a disease state demanding delivery of health care in stationary conditions with the indication of the list of the recommended laboratory and tool methods of researchers, and also registration of the direction with the indication of the clinical diagnosis in need of delivery of health care in stationary conditions in a planned form. Carrying out correction of the plan of inspection and the treatment plan, taking into account the clinical diagnosis, a condition of the patient, features of a cause of the disease, presence of associated diseases, complications of a disease, and results of the carried out treatment on the basis of standards of medical care and clinical recommendations. Prescription of medicines according to an established order. Execution of the protocol, the decision of the medical commission of the medical organization, entering of record into the outpatient card at prescription of medicines for medical use and use of medical products according to the decision of the medical commission of the medical organization. Conducting examination of temporary disability in accordance with the established procedure. Implementation of dispensary observation in accordance with the established procedure. With respect for frequency of service and duration of dispensary observation. Ручку. Performing medical examinations in accordance with the established procedure. Appointment by their results in case of need additional medical actions, including establishment of dispensary observation. Так, а Гемодинова?
Это моя. Отличненько.
Criteria for assessing also. Criteria of quality in stationary conditions and in the conditions of a day hospital. According to the order 520N, maintaining medical documentation, the medical record of the inpatient, the history of childbirth, the history of development of the newborn, further the stationary card, filling of all sections provided by the stationary card, existence of the informed voluntary consent to medical intervention, primary survey of the patient in terms of delivery of health care in reception or operating structural unit, for the profile department, a day hospital or department center of anesthesiology, as station of the medical organization. Registration of results of primary survey, including data of the amnesis of a disease entry in the stationary man. What order of the Minister of Health? Criteria of quality on groups of diseases. Criteria of quality of specialized medical care for adults in an acute disorder of cerebral circulation. Codes also you can see. Survey by the neurologist no later than 10 minutes from the admission moment in a hospital. So yes or no. Second, the computer tomography of the head or magnetic resonance imaging of the head with the description and interpretation of result no later than 40 minutes from the receipt moment in the hospital. The computer tomography of the head or the computer angiography, magnetic and resonant angiography, or X-ray contrast angiography of cerebral vessels. To the yes or no, performed or didn't. The peripheral blood glucose level was determined not later than 20 minutes from the moment of admission on the hospital. The platelet level in the blood was determined no later than 20 minutes from the moment of admission to the hospital. Yes or no. Determination of the international normalized ratio and activated partial thromboplastin time was performed no later than 20 minutes from the moment of admission to the hospital. So yes or no. Systemic intravenous thrombolysis was performed no later than 40 minutes from the moment of diagnosis in case of ischemic stroke with medical indications and absence of medical contraindications. So yes or no. Spinal puncture and examination of cerebrospinal fluid in the presence of meningeal symptoms and no signs of hemorrhage according to computed tomography or magnetic resonance imaging of the head, yes or no. Consultation of the neurosurgeon no later than 6 of the diagnosis of intracranial hemorrhage is executed, yes or no. Treatment in the conditions of the block or chamber of intensive care or intensive care unit no later than 60 minutes from the receipt moment in a hospital is begun, yes, no. The standardized screening testing of function of swallowing no later than 3 hours from the receipt moment in a hospital is executed, yes or no. Assessment of the degree of impaired consciousness and coma on the Glasgow scale and neurological status. Monitoring of vital functions, blood pressure, pulse, respiration, oxygen saturation in the blood was performed or not, yes or no. The quality indicators are used by the Maryland Association of Hospital and USA, United States, America, acquired hospital infections, second surgical wound infections, hospital mortality, newborn mortality, operational lethality, unplanned repeated hospitalization, unplanned hospitalization as a result of outpatient procedures, unplanned returns to departments of special treatment, unplanned returns to the operating room, unplanned returns to the emergency room within 72 hours, stay of patients in the emergency room over 6 hours, divergence cases between initial and final X-ray inspections of the patient which were taking place in the emergency room and demanding changes in maintaining the patient. The registered cases when patients left the emergency room before completion of treatment, interruption of the outpatient preceding day of its carrying out, steps of quality control of medical care, interdepartment control, manager of department, deputy chief physician, medical commission, committee of quality of governing bodies of healthcare, license commission of governing body of health. We talked about medical commissions today. So that's created in the medical organization. In difficult cases, when it is very difficult to doctors don't know about diagnosis, have some questions, and the commission can decide this about determination of working ability of citizens, professional suitability of some categories of workers. So we told about it, about consultation, that it is the meeting of several doctors. Non-department control. In Russia it is Roszdravnadzor, medical insurance companies, compulsory health insurance, territorial funds, NGOs, executive bodies of social insurance fund, professional medical associations, bodies of consumer protection. Article 79. Independent assessment of quality of rendering services by the medical. Independent assessment of quality of rendering services by the medical organizations is one of forms of public control and is carried out for providing to citizens information on quality of rendering services by the medical organizations and also for improvement of quality of their activity. Independent assessment of quality of rendering services by the medical organizations is not carried out for quality control and safety of medical activity, and also examination and quality control of medical care. Independent assessment of quality of rendering by the medical organization provides assessment of conditions of rendering services in such general criteria as openness and availability of information on the medical organization, comfort of conditions of providing medical services and availability of their receiving, waiting time of providing medical service, goodwill, politeness, competence of employees of the medical organization, satisfaction with the rendered services. Quality managing, for example, the Japanese experts offered the closed quality management cycle on stages: search of a problem or identification of defects, observation, understanding key part of the problem, analysis or identification of the main reasons, holding actions or action for elimination of the reasons, check or confirmation of efficiency of actions, planning of new level of quality. So, use of the objective statistical information for quality management is most reasonable.